Great. So good morning, everyone, and welcome. Apologies for the slight delay. We are, of course, having some last-minute technology issues. So good morning, good afternoon, and good evening, depending upon what time zone you are joining us from. It is my pleasure and privilege to welcome you all to today's session, which is entitled Engaging Local Private Sector Companies to Achieve Global Health Supply Chain Goals. And today we have a deep bench of supply chain experts who bring supply chain management, logistics, distribution, technology, innovation to our discussion today. So let me thank them in advance for their valuable time and their willingness to engage with us on this important topic, and most importantly, to challenge us to be thinking about new ways and more effective ways to engage them in some of these local markets. So we really appreciate your dialogue and your inputs. And of course, thank you to the participants who have joined us in the call today. We have almost 100 people joining this morning, so thank you. And let me remind everyone that this is actually the third webinar in a series that Palladium has hosted, looking at some of the global health supply chain challenges. The first webinar focused on procurement systems and how to strengthen the procurement of essential medicines, specifically in Africa. The second webinar focused on strategic realignment of public and private sector supply chain activities, kind of within donor-assisted programs. And then, of course, today's webinar is the last one in the series, which is focusing on the private sector's perspective. So again, welcome and thank you for joining. And now let me move into our introductions. And I'll start with myself. My name is Cindy Slizek. I am a senior technical advisor for private sector health for Palladium's health practice in the Americas. And I will be the moderator for today's session, AKA our timekeeper and general troubleshooter. And joining me today, we have range of participants, Mr. Prashant Yadav. Can we move to the next slide, Zach, please? I'm sure it's coming up. You'll see our names of our participants very shortly. So Mr. Prashant Yadav, who's trying to log on at the moment and hopefully will be joining us soon. He was having a little bit of technical difficulties. In addition to Prashant, who will hopefully join us momentarily, we have Mr. Clinton D'Souza, who is General Manager with PICMA Africa Ltd and brings more than 20 years of supply chain expertise. Welcome and good morning, Clinton. We have Ms. Jessica Vernon, who is co-founder and CEO of Maisha Meds, an organization that is bringing technology to the point of sale. So thank you, Jessica, for joining us. We have Mr. Shamit Shah, who is the CEO for Freight and Time East Africa, which covers over 9 markets in East Africa. Shamit, could you give a wave? Great, thank you. And then finally, we have Mr. Sharing Tekekara, who is Executive Vice President, West Africa for Market Access Imperial, an Africa-wide organization that provides supply chain logistics and distribution. And so just a reminder to our panelists, if you're not speaking, you can go ahead and keep your microphone muted. Our structure for today's session, and Zach, could you move us to the next slide, please? We're still on the introduction slide as far as I can see.
Hey, I don't know if there's a delay here, but I put it to the next slide about a minute ago, and it's not showing up.
It's not showing up for me. Can anybody see our agenda?
No, I can't see it either.
Okay. All right. Well, take my word for it. That's our agenda for this morning. And what we are planning to do when Prashant comes online, he's going to help us kind of give the big picture overview of what he sees as some of the big opportunities for where and how we can engage with the private sector. And then each of our participants is kind of going to give their unique perspective on how they see what the opportunities are and what some of the key market barriers are. And of course, give us an idea of a little bit about their companies and what they do specifically. So we have planned for a few minutes of question and answer at the end of today's session. And please, if you do have some questions for our panelists, feel free to include them in the chat box. And we will try to address them when we get to the end of our session. There we go. Now we can see our list of speakers whom you've already met. So we've already had a couple of unanticipated technology challenges, and we are actually all joining from different parts of the world. So please bear with us. We all know that internet can be unpredictable at times, not to mention the connection challenges. So I'll do my best to help keep the conversation flowing. So let's see if we can move now to the next slide, which is just kind of setting the stage. Great, we're now up and running. So our goal for today's session is actually to have a dynamic and frank discussion on ways to increase the private sector's engagement. And as I said, our speakers will provide their unique perspectives on some of the barriers and enablers. You have seen that all of our speakers today are senior executives from organizations that have deep experience. Many of them come from the commercial supply chain businesses. They obviously know their markets very well, understand their market opportunities, and in some cases have experienced firsthand collaboration with donor-supported programs or observed some of the impact of those programs on their local markets. So what's actually exciting to me is that this kind of dialogue that we're having today is reflective of Palladium's approach to private sector engagement, which recognizes that the private sector really does need to be at the table and that we need to be having these discussions early and often, and try to understand what are the real barriers and incentives to their participation, and then of course focus on identifying market-based solutions. So with that introduction, we will pause for just a moment and see if Prashant is able to join. If not, we will move on to Clinton and we'll use Prashant's remarks to actually frame the discussion a little bit later on.
I think Prashant is with us. He'll just need to unmute himself, as well as Georgie will need to unmute. So let's try that.
Okay, so let's move over to Prashant's slide. Welcome, Prashant. I'm sorry that you missed our introduction. Thank you for joining, and we welcome you and look forward to hearing your overview. So thank you.
Thanks, Cindy, and my apologies, everybody, that my video and audio hasn't worked out perfectly. Nevertheless, looking forward to this discussion. I want to start by saying that it's an important area that many of us who work on supply chains for healthcare and international markets have focused on. It's by no means a new topic, but many things that have occurred in the last few years have made it important and pertinent. And one of the key themes that cuts across much of the discussion around global health supply chain programming today is sustainability. How do we create long-term local ownership? And a key actor for sustainability and long-term participation by local in-country actors is the participation of the local private sector. And again, I think I want to emphasize that this discussion is about the local private sector, and local can have very different meanings to people, but what I'm referring to is not just global multinationals, but companies which are regional, continent-wide, or national level players in the market. And so when we've thought about this in the past, I think we've also acknowledged that the private sector is very diverse. And when we talk about local private sector, someone is talking about wholesalers and retail pharmacies, and someone else is talking about large logistics companies, and someone is talking about hospitals and clinics. So it's important for us to keep in mind what type of the local private sector we are talking about, and I will try and explain at least 3 different threads of local private sector engagement that we see. Can we go to the next slide, please? Yeah, so think of it this way, that there are 2 channels, public sector supply chain, which is where a large part of the focus of global health programming has been, and the private channel, where patients or beneficiaries go and obtain health products and pay largely out of pocket at this point. And then there are 3 different modalities of local private sector engagement. One is, of course, the private sector as a source of supply. And currently, we think of it as a source of supply for the private channel, which means if someone goes to a pharmacy, yes, a private wholesaler is supplying that pharmacy. But increasingly, we are seeing that there are greater opportunities of the private sector acting as a source of supply to the public sector supply chain, such as local wholesalers and distributors, not only providing a supply in a national tender basis, but also becoming providers of health products to regional, or in some cases even directly to health facilities. And that model is starting to show some signs of both economic viability and also quality and other characteristics which have been the reasons of concern in the past worked out, especially models such as the prime vendor model that has been used in Tanzania. And in this area, it's important to think about having stronger regional wholesalers and distributors, because too fragmented a market may not necessarily get us what we are seeking. The second thread is private sector supply chain services. And here we've talked in the past and discussed how do we bring local third-party logistics companies to act as providers of supply chain services to the public sector supply chain. Again, an area which has been experimented with, lots of early positive results, but still not entering into wide-scale programming yet. The second area here is the use of new data and other sort of technology innovations that have become available in the private sector supply chain, and how do we bring them quicker, faster, in a more accelerated manner into the public sector. And that's, again, a very fertile area for thinking about how to embed that in future programming. And then when you look at the private sector supply chain services, we've oftentimes not thought about how do we leverage all of the new things that are happening in data, and especially point of sales data, which Jessica Vernon hopefully will describe their work in this area, but also many other groups which are doing similar things in using technology to ensure that the private sector channel, the pharmacies, the clinics, the wholesale, the distribution can benefit and can have greater efficiency, so that we start including that in a larger public health infrastructure, and not just think about that as outside of the overall public health infrastructure. And the last one is know-how. And we oftentimes make comparisons that the commercial sector has a lot more supply chain expertise. We don't do enough to bring it into the public sector. So 2 things here that are important to keep in mind. One is that past attempts have focused on bringing supply chain know-how and expertise from the private sector, but largely from global multinational private sector. And we have to acknowledge that given the context richness in some of the markets that we are talking about, and also the infrastructure constraints that exist, the local and regional commercial sector oftentimes has figured out very ingenious ways of overcoming the local constraints or the ability to work with the kind of infrastructure that exists. And we haven't done enough to bring that know-how and expertise into the more traditional central medical store models or other distribution approaches. So that's an area where we need to do some more work. And then the last thing is the private sector channel itself, which means wholesalers themselves or private pharmacies of some relatively new and nascent pharmacy chains. Are they exchanging information amongst themselves? Some of them have a much better supply chain knowledge and much better supply chain expertise, and others don't. So can there be a better peer exchange of such know-how between private sector firms in the country? And here I'm referring to not only wholesalers and pharmacies, but also perhaps 3PLs. So that's another area which we haven't done as much on. In all of this, I think it's important to keep in mind that two things stand out for this agenda to progress. The first is that the local private sector needs a much stronger or a much more long-term view of contracting. Given that these are not companies such as global multinationals who can park aside a small sum of money for CSR or some kind of social program, they are private sector firms which will depend on clear contracting. And if the expectation is for them to make new asset investments to go into areas which they are not serving, whether in terms of therapeutic area or geographical area, then they need a visibility of future revenue and some more confidence that it won't be just a project that will come for a couple of years and then go away. They'll need a much longer term view of what the revenue stream in the market could look like. They also need different types of investment capital. So we need to think about how can global health programming act as the market maker or the anchor purchaser for some of the local private sector actors. And then the modalities of contracting are such that not everybody who is a private sector 3PL or a private sector pharmacy or a new point of sales technology platform would be able to get into contract awards or things that national governments and global agencies do. So it's important for us to create a blueprint so that everyone feels, I know where can I hang in this structure, in this framework, my own work and bring it to help public sector supply chain. And that blueprint doesn't exist currently. There are companies, including some here in the panel, who would say, we're not seeking more grants. We are not here to get contract awards. We just want to find a way to get our work to contribute to the public sector, but they find it increasingly hard in terms of how to plug in. And the plug-in requires making the assumption that there is a blueprint in which you can plug in. So building that blueprint is something that is the need of the hour, both from the standpoint of national governments, creating that, and also for global donors and global agencies helping national governments create such a blueprint. So I'll stop there. I think our panelists are going to talk about each of these areas very specifically. I also want to mention that some of these blocks that I described in the matrix structure may apply better for one particular therapeutic area at the start. So we may not be able to do it all across for all therapeutic areas. Maybe malaria is more suitable to get started with the private channel portion, and HIV/AIDS is more suitable for the 3PL and things like that. So I think we have to keep in mind that there could be specific ways for each of those blocks to be addressed. So with that, back to you, Cindy.
Great. Thank you so much, Prashant, for that strategic overview. That's really helpful for framing the discussion. So now, Clinton, we would love to hear from you a little bit more about PICMA and how to leverage specifically some of that private sector know-how that Prashant was talking about. So welcome. Thank you, Clinton.
Thank you, Cindy, and thank you to Prashant. Can you guys all hear me okay? Great. So thanks for the opportunity to join today. Just very briefly on PICMA. We're a company that was created last year, 2020, yes, in the midst of a pandemic, and as a combination or as a consortium organization of four companies. And our goal for coming together was really to focus on developing the supply chain skills and expertise in Africa, on the continent, and we represented in 4 regional offices. Our head office is in Zambia, but we've got offices in South Africa, Uganda, and Nigeria as well, and run programs in about 9 or 10 African countries. And really our goal is to do that with local expertise and skills, fundamentally around the areas of supply chain consulting, but also on supply chain execution projects. So again, thanks for the opportunity to join the panel. So just in terms of specifically looking at the knowledge management component that Prashant had sort of described for us, I want to just highlight 3 quick areas that we ought to consider addressing, or at least thinking about in this blueprint that Prashant describes. The first would be taking a much closer look at supply chain qualifications and skills. And what I mean by this is that if you look at the contrast, the private sector gravitates towards individuals to run supply chain operations or manage supply chains who are qualified to do so, have got degrees, have got years of experience, etc. If we look at the public sector supply chain operations, generally these are run by pharmacists or medical doctors, and have got far more of a sort of clinical slant or emphasis versus sort of supply chain best practices. I think this is one area that has been highlighted, and I know that there are initiatives like People That Deliver to try and address these. But I think if we sort of consider taking that conversational level up, or that looking at this structurally a little bit more deeper, 25 years ago when I got started in this business, supply chains were run by a warehouse manager who was sort of reported to the finance manager, who reported to the finance director, to the MD or the CEO. Today, of course, you have chief supply chain officers who are at the executive board level. And so what has happened in the commercial sector is that the role of supply chain has been elevated to that board level. We haven't yet seen that in the public sector. So one of the things we could think about is structurally, how do we get supply chain to not report to the central medical stores agencies, not report to the Directorate of Pharmacy or some such part of the organization, but report directly to the Permanent Secretary or the Minister of Health, and elevate the importance of supply chain. That would then give greater gravitas to supply chain overall within public sector, and sort of put it on an even playing field with private sector. So that's sort of one area. The second area would be knowledge retention. We hear this all the time. Consultants like ourselves go in and we do some capacity building, some training within public sector systems, and then in a year or two we've got to go back and do it again, or the next lot come in and do it again. And if we look, at the staff turnover in public sector, it really isn't that different from what we see in the private sector. When I was in the commercial supply chain operation in Africa, we were experiencing 20 to 25% staff turnover annually. So every 4 years, essentially, you have to replace your entire staff. And the reason why the organization continues to operate at a high level and continue to improve customer service is because the knowledge is retained in the organization by sort of formal quality management systems, things like ISO 9000, etc. I know there's a push for some within some central medical stores agencies to go down this road, but I think that this is an area that is not invested in enough if we really want to see public sector supply chain agencies retain the knowledge that is being invested in by the government agency, by donors. The last area would be, how do we consider the shift of the government role to supply chain stewards? So if governments are not particularly strong at running supply chains, how could their role change? And I think that part of this is got to do with Number one, political will, of course. Number two, offering government supply chains a different set of skills and a different ways to tap into those sorts of skills: contract management, vendor management, performance management, things that, you know, implementers and private sector do very well. But also, I think on the flip side, and we'll hear from our panelists, the other part of this is, you know, what makes this attractive for the private sector? And so just because, you know, governments perhaps wake up or become increasingly aware of the potential benefits of engaging with private sector, you know, how do we equally get the private sector to get enthusiastic about working with the public sector? So as an opening sort of comment, Cindy, I'll stop there. Thank you.
Great, thank you so much, Clinton. So in your remarks, I'm kind of hearing a little bit of tension between the idea that donors are advocating for greater private sector engagement, yet at the same time, many governments continue to be focused on the development of their own medical supply systems. Could you expand on that a little bit?
Yeah, thanks. Yeah, I think you know, as we look, and obviously our area of expertise is Africa, and our knowledge base is in Africa. If we look at many of the sub-Saharan African countries that receive a lot of donor-funded support for their supply chains, there's most certainly a continuum. There are some countries that are significantly advanced in terms of the way that they're working with and engaged with private sector organizations. Sometimes through opportunities that have occurred, sometimes sort of tragic incidents like warehouses burning down, other instances with new warehouses being built, or opportunities to more deeply engage with private sector. And then on the far spectrum, you have other countries that have actually developed their own supply chain skills pretty well, and really the local market itself doesn't lend itself to private sector engagement. So I think what would be a good idea, number one, would be to appreciate that there's a continuum, and that you know, within countries there's going to be different levels of sort of private sector engagement, but also that there needs to be acknowledgement that, and Prashant talked a little bit about this, but you know, what brings the private sector to the table? What brings the enthusiasm for the private sector to get involved? And there are some key triggers that need to be acknowledged. And I think that part of recognizing these issues, and you know, I'm sure my colleagues on the panel are going to talk a little bit about this, you know, but the biggest one probably is getting paid by government if a private sector organization chooses to work with a government. And is there a shifting role from donors where instead of you know, putting money into building capacity of government entities, they could in fact take some of that money and shore up bad debt or something like that? So I think it needs on this continuum, if you wanted to push private sector engagement further along, we need to be thinking differently all around about what that looks like and where some of these donor dollars get pointed to. I think that acknowledging that enthusiasm built on both sides is not going to happen because, you know, donors want it to happen. It's going to happen because the opportunity is there, the political will is there, and there's enthusiasm from all parties to make it happen, which I think there's more that could be done to sort of create that fertile ground, if you like, Cindy. Thank you.
Great, thank you so much, Clinton. So now we're going to move to Maisha Meds and ask Jessica Vernon to give a quick overview of the ways in which you all are influencing the supply chain business. So thank you very much. Jessica, over to you.
Of course, thank you for having me. So I wanted to give you a bit of a background on Maisha Meds and kind of how we grew to what we're doing currently. So I think the initial thinking behind the model was grew out of some work I was doing within the public health system in rural Kenya. And many of the small facilities that we worked with were stocked out of medicine quite frequently, and we would send people to small private pharmacies nearby to get medication. We never really knew if they got it, if they got the full course, if they could afford it, and then whether the medicine they received was high quality. So became really interested in what exactly was happening through that channel. So while I was in medical school, started building this out as a research project. So initially we built a very simple, small point of sale system that works online and offline, syncs with a cloud-based server, and that allows us to capture all information about what's happening in these small pharmacies and clinics in rural areas. The network currently is about 400 pharmacies and clinics, primarily in Kenya, but also in a few other countries in Africa. We have sites in Tanzania, Uganda, Zambia, with Clinton, Nigeria, and then starting to be in Ethiopia in the public sector as well. And we get really detailed information about what products are sold, what brands are sold, what their supply chains look like, who these small pharmacies are buying from. Is it, central large suppliers in Nairobi, or is it smaller wholesalers in the region? And then as we started capturing this really rich data set, we're currently getting about 150,000 patient encounters each month. So it's quite a bit of data coming in. We started thinking about additional ways that we could use it to influence what the supply chain looks like overall. So first of all, we have somebody fantastic from IQVIA who's taken our data set and kind of transformed it into something that's really useful for global health funders and for pharmaceutical companies and suppliers as well. We have dashboards that update monthly on prices, brands, specific to different, malaria products or family planning products or other things. And we're able to do things like see shortages that are starting to happen in the market related to COVID changes in supply chain. We built out dashboards on that earlier this year in partnership with Prashant. And we've been able to actually see changes in global health, how changes in global health policy have influenced the brands that are purchased by patients at the last mile in some of these rural areas, and seen really interesting trends over time in that. Once we started getting that point of sale data, we also started thinking through exactly what else we could do with it. And we built out 2 additional products, a reorder system that's effectively an e-commerce platform where we work with high quality suppliers in the region and help them to gain access to these smaller pharmacies and clinics. And we work in partnership with about 8 suppliers in Nairobi to do that. And then our kind of latest and most exciting piece of the business is building out incentives and payment infrastructure to actually enable something that looks a little bit more like an insurance platform for some of these private pharmacies and clinics. We're currently testing this with USAID and the Gates Foundation for malaria case management. So making sure that patients are accessing malaria rapid tests before treatment, and that they're accessing high quality treatment when they do need it, only if the test is positive. And we've designed it so that they get the patients get discounted products and the providers get paid a small incentive to do this. And it's currently being tested. We'll hopefully have results to share later this year, but we're really excited about the potential to scale this across the region and to have this structure of payments actually change the incentive structure for global health funders as well.
Great, thank you, Jessica, for that overview. Very exciting stuff that Maisha Meds is doing. From your perspective, it's not my dogs who are outside. From your perspective, what is the most exciting technology innovation that you think is likely to change the supply chain model for global health?
So we think this payments piece that I mentioned last year has the potential. So in markets where private sector pharmacy and pharmaceutical infrastructure works really well, you usually have somebody who kind of incentivizes that piece of the transaction that happens at the last mile. So it isn't just that the FDA works really well in the US, it's also that you have insurance companies that are paying for the medicine that gets received and make sure that there's a prescription happening alongside it, that the medicine's flowing through a supply chain that is high quality, and that provides all those checks along the way. And so we think that by changing the way that global health funding is delivered and enabling that transaction to happen at the last mile, you have the potential to also address some of these issues related to medication quality, related to access to diagnostics, and whether people are getting diagnosis before treatment, and whether people are, whether antimicrobial resistance is developing at the level it's currently developing. So there's huge potential implications for just enabling smaller incentive-based payments at the last mile, and we think that that's the future of healthcare in this region.
Great, thank you very much. All right, I think we are going to move over to Shamit. Shamit, are you still there? I don't see you on camera, but can you hear us? Oh, there you are. Yes. Welcome. Okay, over to you, Shamit.
Thank you. No, the link here in Alice isn't that great, so I switched off the camera. But, really delighted to be on this panel. Quite surprised to find myself on this panel, to be honest, with such sort of respected panelists in our company. But, I wanted to basically just give a little background on Freight and Time. And at the same time, I will probably, some of the comments I'll be making have already been made. Prashant made actually some very, very valid points. And perhaps our experiences are real world experiences of exactly what he was talking about. So, Freight and Time is, I think, a unique homegrown 5PL logistics provider with over 20 years of experience and a footprint across countries in East Africa. And sort of critically, we have our own offices in every airport, every port, and in every border point in the region. And generally, if something's going to go wrong, that's usually where it goes wrong at some of those control points. The other sort of unique angle of Freight and Time is that we offer the entire range of logistics under one umbrella. So from courier, air freight, sea freight, we do regional road freight across the whole region, brokerage obviously across the region, for warehousing, and now quite importantly, last mile distribution. Our aim is really to do customized supply chain solutions, and our sort of mission is that if we're not adding value in the supply chain, we shouldn't be there. Over the years, we have developed and have got extensive experience in the humanitarian space. We were one of the original partners under UPS handling PEPFAR into the region, and that's over, 15 or 20 years ago. And over the years, I think we have now sort of built up a reputation as a specialist handling humanitarian cargo, and work with pretty much every single major donor, either via global partners or, in fact, directly more and more. So, with relation to today's topic, we've seen over the last few years we've seen a big change in focus in supply chain logistics in this space. As the upstream logistics has improved and become a lot more efficient, we now see that the focus is turning and changing to downstream logistics and very much the last mile space. I think and as Prashant mentioned as well, I think there's now a big renewed emphasis on sustainability, building local capacity or regional capacity, finding local partners, and now obviously the really big buzzword is the public-private partnerships and how can they really happen and come online. So as Freight and Time, over in the last few years, we have focused also on this space and worked hard to develop our capacity and our capabilities with last mile distribution. And so I would actually just like to highlight two projects that capture both the last mile aspect and the public-private partnership element of trying to make these things work in a different way. So our first project, our first pilot project, was actually in Uganda. where we were asked, or we put together a proposal to take over the last mile cold chain delivery of vaccines in 3 districts in Uganda, around Kampala and Entebbe, and also delivering into the lake. This was supported by Gavi, the Global Fund, Norfund, and UPS. But, and I think most importantly, obviously, in country by the Ministry of Health and NMS, National Medical Stores, who are tasked with doing the distribution of medicines within Uganda. So, we manage the monthly deliveries of vaccines to the very last mile, to health centers, health clinics. And, it's not rocket science. We could manage the deliveries, we could get products from A to B, we could make sure that the temperature was maintained, we could make sure that we had proof of deliveries. But the truth of it was that when we actually looked at the supply chain and said, where was the real issue, we realized that the problems were really that there was a lack of visibility in that last mile. I think just as we heard from the previous speaker. So we also then adapted our own app to not just do the track and trace in the real time temperature monitoring and EPODs, but we added in a stock function visibility, which allowed the clinics and the hospitals to see their own consumption more or less in real time, allowed them to also place orders online, which was one of the biggest gaps in this whole process, and then allowed us to aggregate orders and put them together and manage deliveries. Honestly, the results were tremendous. We improved on time in full deliveries. We were close to 100%. Stockouts were basically eliminated, and coverage really increased dramatically. But it was just a question of building confidence. When the health centers and the health clinics knew that they could place an order, and if we said we were going to deliver on the 5th of February, and we turned up on the 5th of February, I mean, they could spend their time doing what they were supposed to be doing and planning their weeks and days and vaccinations in a much more structured and efficient manner. So, this goes back to, one key point that I will go, really push on is we have to build trust. You've got to build trust between the public and the private sector. So, by the way, I believe Kevin Etter from UPS was one of the key guys who helped make that project happen. So he's on this. I think he's listening in. So hey, Kevin. On the back of that project, we actually embarked on a much bigger, more ambitious PPP here in Ethiopia. I'm actually dialing in from Addis. This is supported by the Global Fund, but again, very importantly, in partnership with Ministry of Health and EPSA, EPSA, which is the Ethiopian Procurement Services Agency, which manages the distribution of medicines within Ethiopia, just like NMS in Uganda and KEMSA in Kenya. So we are working with EPSA in the Hawassa region to see if we can improve and the planning and distribution of not just cold chain and vaccine commodities and reagents, but in fact the entire range of commodities, essential meds, supporting products across all the different programs, whether it's USAID, Global Fund, Gavi, etc., and own source products, using now combined deliveries to improve the frequency of delivery and to hopefully also improve the efficiency of the deliveries. We're actually using the same assets that existed on the ground, so the government assets that are already in place, but just actually adding our know-how, adding our experience, using the app to help some of the last mile, the health clinics order and manage the process. We've been here now for about 6 months, and the early results are really promising. And they're already talking about how do we scale this and how do we start getting them to, how do we start looking at the way that this can now move out across the rest of the country. I mean, they're going much quicker than we're prepared for. So, you know, I believe that these are actually real life examples of successful PPPs. And we're getting the right people to do the right things. You know, we often ask the medically trained person, nurses and doctors to be supply chain experts. They're not. Having said that, it is very, very important in order for these PPPs to be successful that we need buy-in from everybody, right from the start of the project, or not before the project, well before, at the concept stage. So obviously donors on board, the private sector on board, but the public sector, if they do not believe in it, it will not be successful. That goes back to my point about we do need to break down that mistrust between the private sector and the public sector. Donors, you know, they say all the right things. I think there's a lot of lip service. I think Clinton mentioned this in maybe in passing, but you know, there must be a clear message and there must be a clear agenda. Prashant said the same thing, and there must be a clear path to long-term ownership by the country. How will, you know, some of these projects, how are they going to scale, and how are they going to actually end up going right? How will we teach the public sector to manage the private sector? What are challenges in all of these things? You know, the red tape and the paperwork. I think Prashant said this as well. You know, private sector companies, especially local companies and regional companies, you know, don't have an army of consultants to do project write-ups and proposals. They don't have the time, the resources to do all of this. And timelines, you know, whenever you embark on one of these projects, it takes 12 months to get anything approved, signed off, and start some sort of implementation. And, you know, by that time, probably the goalposts have changed or the situation has changed. So, you know, I think it's very, very important bringing private sector into this space. We have to enable it. This will build capacity and it will bring in some major efficiencies. But I think there's still some way to go, and I think every partner in the process needs to be part of it. Thank you.
Thank you so much, Shamit, for those provocative and frank comments about some of the challenges that exist in terms of increasing private sector engagement. So we really appreciate your insights. Thank you very much. Now I would like to transition over to Sharing Tekekara, and for Sharing to give us his insights on how we can better leverage some of that private sector know-how. Thank you.
Thank you very much. So first of all, thanks for inviting me, and thanks for the audience and the very eminent panelists who gave an array of problems and some solutions, like what Shamit said, you know, how best we can, you know, position private sector to be part of the solution. Now, coming to Imperial, just to give a bit of introduction, I think we are also an organization that is very much rooted in the welfare of the communities that we serve. I mean, I know it's a big thing to say for a private sector, but beyond profit motivation, we've started saying that if we create value for our consumer, for our patient, that sustains our profitability. So we are a company that is listed on Johannesburg Stock Exchange. It's a local company. We are present in 26 countries in Africa. We employ close to 27,000 people. So it is quite widespread. And what we offer is connecting Africa to the world. That is what that's our motive. And we connect patient to quality products and services. Now, this is what we are in. We have two divisions. One is market access, which actually does the distribution bit, which Prashant said. So we do buy and sell, we inventorize, and we do creditor, debt management, complete risk management in the market. And another division does the logistics facility, which includes managed warehousing, you know, last mile deliveries, custom build of warehouses, and all of that, right? So what can we bring to the table? There are a lot of efficiencies that private sector brings because the scale is built in an organization like ours, we deliver 5 million packs minimum of medicines in a month to almost 40,000 outlets just in Nigeria. Now you can well imagine, for that I have 1,200 people on the field. All of them are enabled with the Salesforce automation devices. We track the performance, we track whether they sell at the right prices, at the right quality, is the temperature control maintained, is the expiry maintained. So, you know, we have to do this because we are accountable to large multinationals and local companies to ensure that we do the right thing, right? So for us to extend it to something like a donor program would bring in the scale advantage and the existing technology and solution that we already have built, right? Of course, we may have to remodel it like what Jessica said to a particular situation, but we are happy to provide that solution to the donor programs to improve the efficiency. So that is one. A lot of it is built, we can scale it. And of course, with that comes the cost effectiveness, you know, because I've seen a lot of the RFPs in which it is sent out to develop programs. So I always wonder, why do they have to develop things? Why do we have to reinvent the wheel when we can do it at marginal, you know, investments, right? So that's something that we got to look at, because we always believe that you got to get more bang for the buck. In more patients should get helped, you know, in each dollar that is spent, and that has to be spent mostly on medicines itself, right, rather than building the infrastructure around it. So we can bring that. Definitely accountability is a big thing, especially when you operate in Africa. There's a lot of slips between the cup and the lip, a lot of malpractices. I don't know how much of you know about what happened in the AMFM program in Nigeria. You know, a lot of money was spent, but if you really do an impact analysis, you'll be shocked. And I know that people who are close to these programs in country see the kind of wastage that happens, and it is really criminal, right? So if you don't bring accountability into this, and then your donors are not actually getting the benefit of the monies that they spend in these countries. So that is where we apply a lot of technology, infrastructure, and the know-how of the market. Like, that is important. Like, many times we have to be part of the solution modeling. So we know the different players in the market, who has to be actually consulted and incorporated into the model. So that local know-how is very important in rolling out the right programs and the right structures, right? Now, how do we achieve the success? Definitely, we can leverage our technology, infrastructure, and personnel. And like what Prashant said, anything that we build should be sustainable. It should be long-term success. So as a private company, we are responsible to our shareholders. But at the same time, we are more than happy to work on these projects wherein it benefits, you know, the society, and also, of course, make some money out of the whole thing. I mean, private sector has to be profit motivated. Otherwise, you know, there will not be long-term interest, right? So that's definitely on. And I think, you know, as a company, because we have a presence in many of these countries, we work with the health authorities, we work with the hospitals, pharmacies, and downstream. If the private sector or, you know, at a global level, when these programs are evolved, if you can make us part of solution modeling, then probably we can give you very good insights in country, which can actually increase the speed of rolling out these programs. Otherwise, it gets stuck here and there, and you wouldn't able to, because I know that we rolled out something for Chai on oncology about a year back, and there were actually 6 players. You know, one fine morning, I get a big LPO of ₦1 billion. There is no payment terms, there is no security of nothing, and say that, okay, now I place the order. I mean, I said, listen, I'm not going to place an order because tomorrow Pfizer is going to ask for money. So then it went away, and then they toyed around with for 6 months, and I said, no, come back, you know. Then we put a solution. So there were actually 6 players whom we had to bring into one ring and then give a solution, right? Then actually it started working. But then that 1 billion is not there. The patient is not there. The paying ability is not there. But at least we made a transparent project. If we are spending $1, it goes to the deserving patient, right? So these are things that we can really bring forth. So this is what I would say. Again, as Clinton said, retention of talent, investment capacity, these are things that private sector can bring onto the table, which is complementary to what we do and what the donors want to achieve. So let me conclude saying that, look, the private sector is ready. You'll be surprised with the element of technology and the scale that is present in Africa, in local companies, which over years we have invested in building businesses, and now is the time to leverage it. Thank you.
Thank you, Sharon. Thank you very much for those important insights. So we are almost at the top of the hour, very close to wrapping up. I think as a way of wrapping up some of these insights, I'd like to ask Prashant if he has any final remarks that he would like to share with us before we conclude the webinar. Prashant?
Thanks, Cindy, and truly enjoyed hearing the four perspectives. By design, we didn't plan it that I would put this in the front and everything, seems to fit. But I'm glad that there is some convergence to the core ideas. One thing I want to end on is that the logistics solutions for private sector engagement are easy, and I'm being bold here to say they are easy. We all know them. We have worked on them for decades. Many of the people on the panel or who have joined us or maybe have not joined us have worked on this. We've created the structures for 3PLs, 4PLs, governments to have LMIS and information flows, new private sector groups like Maisha Meds. I think where we are lacking is not so much how product flows, but how money flows. And when I say money flows, I'm referring to how money from national governments for supply chain services flows, how money from global agencies for supply chain contracting flows, and within that, areas such as national health insurance, will they cover private provision of medicines in private pharmacies? How will that change? So I think the two key things I believe we all should be focusing on, the first will be to making the case more effectively to those who work on health financing and design the money flows for large programs, to think about what is missing in the money flow that can enable some of the solutions for local private sector that we talked about, whether it is underwriting risk or providing working capital credit, or providing new modalities of investment capital, or just plain and simple, make a contract, stick to your contract, and having a monitoring system to adhere to that. Right? So these are simple things, but I think that's what the sector is missing. If we keep going back to the drawing board and saying we don't know the solutions of how to engage the private sector in supply chain, I think we'll waste a lot of time. So again, anyway, that's the note I want to end at. I think the blueprint that I talked about initially is a part of that. So not just financing, but also some way of providing structure so that multiple groups can come together and say, here is how I can contribute. And there is a clear stewardship role defined for the national government in that blueprint. Thank you. Back to you, Cindy.
Great. Well, thank you so much, everyone. We are almost at the top of the hour. A big thank you to all of our panelists and to everyone that has joined our session. I think at one point we had about 140 participants, so that's really great. And just a reminder that this webinar will be posted on the Palladium website, so you'll be able to see it there. And thanks again, everyone. A great session, very, very interesting remarks. So thank you. Take care. Bye-bye.